What's up, guys? Dr. Hunt here, Hunt Physical Therapy. Today we're going to talk about the knee meniscus and how to treat it without having surgery. So what is the meniscus? So the meniscus is this crescent shaped piece of fibrocartilage that's located on the inside and outside of the knee joint. You have one on the inside, one on the outside. About 80% of the time it's the one on the inside that gets injured. And so how do you injure the meniscus? It can be due to aging. You know, as we get older, there's just degenerative changes that occur at the knee joint. And so sometimes just normal activities like walking or stairs can cause a little tear there. In younger folks, a lot of times it's an athletic activity, like you rotate at the knee on a fixed lower extremity, or there's a hyperflexion event like that. I actually tore my inside or medial meniscus years ago in jiu-jitsu. I was trying to pass somebody's guard, and so my knee was hyperflexed and my foot was fixed, and I felt this searing pain on the inside of the knee joint there. And so you can diagnose meniscus tear pretty easily by having pain on the joint line, either on the inside or the outside. Sometimes there's pain with hyperflexion of the knee joint. Also with straightening out or extending the knee, there'll be pain or there'll be clicking or locking when you do that. And so that's how you know you have a meniscus tear. But take heart. There's a body of evidence that shows that there's really no difference in most meniscus type injuries between rehabbing it, doing physical therapy or conservative stuff, and undergoing surgery. And so what you should take by that is always try the conservative stuff first. You know, anytime you have knee surgery, that puts you more at risk of arthritic changes in the future. So take heart, there's things you can do for this. And a lot of times it can take some time. I mean, mine took about 6 to 12 months, but it healed up great. Haven't had any trouble since. So now let me go over some of my favorite stretches and exercises that you can do at home to treat a torn meniscus. All right, let's go. All right, guys, like I always say, before you do any kind of exercise or stretching, you should warm up. If you have access to a bike, that's awesome. I love rehabbing my patients with a torn meniscus on a bike because it's low impact, but it provides enough compression that it brings in nutrients and fluids and things that tissue in the knee joint needs for recovery. And so cycling's great for 10 minutes, either indoor or outdoor. If you don't have a bike, just walk to tolerance, you know, for up to 10 minutes. If you can't do a full 10 minutes, that's fine. Just do what you can. But, you know, we want to warm up the joint and the tissues of the joint before we stretch or do any kind of exercise. So the first two techniques I want to show are joint mobilization techniques. They're designed to decompress the knee joint, create a little bit of space, and possibly take some of the pressure off that torn meniscus to allow it to heal a little bit better. So the first one, pretend it's my left knee, lie on your back, and place a towel, a rolled towel, so it's firmly pushed against the back of the joint line, and then you reach down and grab your lower leg and just kind of push your foot down towards your butt. Don't take this to where it hurts, just take it to where you feel a little stretch, maybe some decompression in the knee joint, and hold this 30 to 60 seconds. I even do this sometimes with my hand. If you don't have access to a towel roll. But again, I'll show with the towel roll, back of the knee, and then reach down, grab your lower leg and push your foot back towards your butt for about 30 to 60 seconds. Okay, so there's another stretch you can do at home with the towel. Let's see. So take the towel now, unroll and place it behind your knee like this, and then grab the ends of the towel with your hands and firmly pull away from the knee so that it kind of fixates that towel there behind the knee joint. And then, without letting the towel move, sit back like you're sitting your butt on top of your heel, or the back of your heel rather, and to hold that 30 to 60 seconds. Again, you're pulling the towel away from the knee joint to get that stretch, and then hold the towel securely so it doesn't move, and sit back like you're trying to touch your butt to your heels. Hold that 30 to 60 seconds. You can do these every day if you want. All right, now I'm going to show you some exercises you can do to help that damaged meniscus. All right, let's go. All right, guys, to rehab the meniscus, you got to stretch out those calves. So tight calves just place unnecessary stress on the knee joint. And so find you a step or something like that at home, or if you don't have a step, just get a thick book, piece of wood, just anything like that. Have your feet about halfway off. Keep your weight over your ankles and then just allow your heels to drop until you feel a good stretch in the back of the calf. Like any stretch we do, hold it 30 to 60 seconds. And then from there, you can do calf raises to strengthen the calves. Just go up and down real slow, like that. The great thing about calf raises, you can be really close after surgery and do these. So you can always work around injuries. That's what I always tell my athletes. With rare exception, I never tell my athletes or my population of patients that want to be active just to stop activity completely. Try to work around it to tolerance, and you'd be amazed sometimes what you can do. Okay, so let's talk about balance, because anytime you have a knee injury, your sense of balance, we call that proprioception, is going to be off. There's a lot of reasons for that. I think the biggest is just swelling. Swelling within that knee joint and pain mess with the receptors that send information to the central nervous system about balance. And so anything you can do to kind of help with your balance, try to stand on one leg like that with your knees slightly bent. Okay, to make it more challenging, you can put your foot like on a pillow, or you can close your eyes, because whoa, when you close your eyes, that definitely makes it a little more challenging. You can also practice like picking things up with one leg bent like that. You can see that's really challenging. So just kind of like reach down and try to pick something off the floor. You don't have to go that far at first. Just work on leaning over like that on one leg and picking something up. And then as you get more confident with that, you can go down further. Standing on one leg with your eyes closed, if that's easy, do that and turn your head. You can see I'm shaking there. Sometimes people's balance is so bad, just standing on one leg or on a pillow or something like that, that's challenging enough. So those are just progressions you can do for balance. Okay, so let me show you a couple other exercises you can do with a simple rubber band at home. So you can get these rubber bands at HpT.com or Amazon, just anywhere, but we appreciate your support if you get them at HpT.com. So doing some squats with the rubber band above your knees like that engages those hip muscles, and just it makes it a little bit more advanced than just squatting down without. So just like that. Just do mini squats at first, okay? Don't try to go real deep. Like that, 3 sets of 15. You can also put your back against the door. We've talked about wall squats many times, and that's an option. Okay, so slide the rubber band a little bit, and you can do hip abduction, you can do hip extension, you can even do hip flexion like that, just to work the hips. Strong hip muscles are really important for knee stability, and so great exercises while you're rehabbing that meniscus. As the meniscus heals, and fully expect 6 to 12 months. It's not a quick heal, which can be frustrating. I think that's why a lot of people opt for surgery right out of the gate. And so expect that. And it's always better to let the body heal itself first, but it can take anywhere from 6 to 12 months. I want to point out, as these beginning type exercises become easy, you can check out our YouTube page, Hunt Physical Therapy. Our YouTube channel. There's a video called Best Leg Exercises that shows a little bit more variety of exercises, maybe a few more advanced ones that you can do. Anyway, that's it. Good luck, guys, with that meniscus injury. Be positive. It could heal on its own. There's a good chance it will. So if you like the video, please subscribe to our channel. We really appreciate your support. Feel free to leave comments below, and we'll see you next time. Thank you.